Okay.
Hi, this is Tammy Richmond, and welcome to Talking Sense. It's October 12th, and I'm here with students from USC who are interested in learning how to set up a private practice and or elements of setting up a private practice. So today I've titled the podcast Startup Healthcare Business Basics, 15 Steps to Success. I was asked to briefly talk about my background and how I went from, I think, leaving school into, I was an employee, into private practice, and kind of fast forward to where I am today. And then to share with you some aspects that came from a book I wrote on business fundamentals for the rehab professional, which is a textbook. It's a course book that takes you from an idea of a concept of a community-based or any type of program, private practice, and moving it into implementation. So I'm going to ask all of you to, if you can, mute your headphones or speaker, because I'm picking up some whispering and probably some feedback. And then if you want to go ahead and ask me questions at some point, just go ahead and unmute, and then feel free to stop me.
Okay, yeah, I'm hearing that as well.
Any suggestions on how to do that? Is it
To mute?
Yeah.
There should be a mute button. Do you have a microphone on? There should have been a little bit of a box that came up on the right side, and near that box should be a strip of icons, and one of them should be the picture of a microphone.
Ah, yes, I see that
And if
next to the speaker icon.
Yeah. So if it's green, it's on. If you click it, it will turn off.
Great, thank you.
So a little bit about how I went from school into private practice. And just to give you an ending point, so today I own 3 different private practices, and they are all set up differently as business entities. So one is a sole proprietorship, one is a corporation, and one is an LLC. And I'm telling you that because those are one of the many choices you'll have to make on the small business end. And I can share with you how they became that and why. But let me back up. So I graduated from UW-Milwaukee back in the 80s and moved out to moved out to Los Angeles to take a job at UCLA. Actually, that's not true. I didn't have a job. I came out here to interview, and I happened to get the job at UCLA based on my prior field work, because UCLA was really only hiring therapists with at least 2 years of experience, and I didn't have that. But what I did have was a lot of energy. I had done 3 field work rotations instead of 2, and I had a lot of confidence in my skills based on those fieldwork experiences. And I also was very eager, and I had the personality that I think it takes actually to move into private practice, which is curiosity, hardworking, very open to different ideas, and not afraid to speak up when the opportunity arises. So what happened at UCLA is 8 months into my first job, which was important to me because I was paying off student loans, I got called into the director's office to be told that I was being terminated because the hospital was going through an overhaul of the rehab department. My position, and I was the most recently hired, had to be X'd. And so panic went through me, and my saving grace to one degree is that one of the other things I did when I first took the job at UCLA, and I remember in January, by February I began working for a home health agency on the side. So I was working in the evenings and on the weekends to help pay off my student loans. But that also helped me, right, get to learn the community of which I was now living. I was living in Santa Monica, working at UCLA, and I just came from Wisconsin, where it's nothing like, you know, the city and the city driving and the communities are nothing like what I had grown up with, and I had grown up in a farm community. So I was learning. I thought it'd be great on the job training, a great way to meet people in the community. And so when I got the termination conversation, I knew I at least had home health. So of course I increased my hours in home health. Meanwhile, I went back to my department head, who I have to tell you is now one of my business partners in one of my companies. His name is Dave Powers. I went back to Dave, scheduled a meeting, and I said, you know, I've always wanted to work at UCLA. If there's any job opening that happens now or in the future, please call me first. I want to be in a teaching atmosphere like the University Hospital, and I wasn't here long enough. And I would appreciate any help you can give me in finding another job. So a couple of weeks went by, and Dave stayed in touch with me and said, you know, I think there may be some positions opening up. I just want you to hang in there, and I appreciated our conversation. I don't know how much time it went by, but not very much, maybe a month. And I got a phone call, and Dave said, I can hire you back. Will you take the senior position in the acute care? And you are going to be the only therapist. You're going to have to cover the whole hospital by yourself because I'm not going to be able to hire any other positions in. And while you're here, I will need you to track every single patient you miss so I can justify another position. So part of what I'm talking about is opportunity came to me, and I jumped on it. I said, absolutely. I went in, worked at UCLA, was the senior therapist in acute care. A year later, was able to hire in. A year later, I went back and got a master's degree and moved my time back down to 3/4, gave up my senior position to get more education, went on and moved my master's degree back to UCLA from Northridge and moved my working time down to part-time. And in that interim, where I was moving my hours away from UCLA, two things were going through my mind, and probably similar to you. Number one is I still need to pay off loans. Number two is I don't know anything about setting up a private practice, and I'm already working for the home health agency. And what I discovered when I worked for them is that insurance companies like Medicare only pay for a few visits. And one of my specialties is neurology. So you can imagine I'm working with people with Parkinson's and strokes and other neurological disorders, and there's not much you can do in 8 visits. And so I found myself wanting to say to the families, I'd like to continue working with you, and I know your insurance doesn't cover, you know, you'll have to pay me cash. And so around, you know, thinking around that, I thought, who do I ask? And so I found a small business accountant who I still have today. And I also went and spoke to someone at the time was American Express had business counselors. And so that's my second point, important point, is the first one was opportunity knocks and you walk through it. Second is if you don't have all the answers, you gather experts. And so I seeked out my experts. I sat down with them. I told them what I wanted to do. And I developed my first company, Hands for Health, which is a sole proprietorship in the state of California. And what I ended up doing then is going back to these families and saying, through home health, after the insurances run out, and it seemed like the appropriate thing to say, and if, you know, not every circumstance is appropriate, but I would say to the families, if you'd like me to come back, I would love to continue therapy with your loved one, except you'd have to pay cash. And because I don't have insurance contracts, and I'm not setting up for insurance contracts at the minute. And so that's how I really got started. Hands for Health was my first company. And I began to see people after they had finished all of their insurance visits. And we really moved in from therapy almost sort of in the beginnings of what we would call today wellness, and what I do today, which is concierge care, where I do house calls. So I went back to UCLA.
Excuse me, Sam.
Yeah.
Excuse me. I don't know much about business. What is a sole proprietorship, and why didn't you decide to have insurance contracts in the beginning?
So, and going back to the business tax entities, you have 4 choices of tax entities of which to establish overall, not just healthcare, but when you go to an expert or an accountant, you'll have 4 choices. That is a sole proprietorship, a corporation, an LLC, or a partnership. And within those 4 choices, and how you make that choice is really based on a couple of important external factors. One is the legislative policy that exists in the state. The second is our own scope of practice, our own licensure. and any limitations that may be in that language. The third influence is what is usual, customary, and reasonable, what we call UCR. At the time, it made sense from the experts that I just set up the easiest way, which is a sole proprietorship. I just have to, if you use your name, you do not have to register yourself separately with the state of California, Secretary of State. If you use something other than your name, then you need to register with the clerk of court in Los Angeles County or whatever county you're in. And you also need to advertise your company's name for a series of weeks in a newspaper to make sure that no one else owns that name. And then you pay, fees, business fees, so you have a business tax and a business license. So the recommendation was to start as a sole proprietorship because I wasn't sure how long it would stick, right? I didn't, this was my solution to my immediate opportunity. I think your next question was, why didn't I take insurance contracts? At that immediate moment, I didn't know who to ask, right? I was an employee, young at UCLA. I didn't know how they did billing because when you work for a large institution like a hospital or even assisted living center, you don't see the billing, right? You're just filling in your super bills and handing them at the end of the day. And at the time, it seems like it was quite a long ago, there weren't the, available courses to take on billing. It was, it was kind of the wild, wild west. You were learning by asking, and so I immediately just took cash. And I knew I'd have to figure out how to set up insurance contracts down the line, and I didn't charge a lot for the families. I wanted to be very reasonable. Medicare at the time stated that, obviously if someone's over 65, you have to take Medicare, and I didn't have a PIN number. And back then I didn't even know what it was, to be honest with you. And also, and if you were going to charge cash, it had to be reasonable. Well, when I'm just charging people $25, $35 an hour to come back, it was more than reasonable, since the average Medicare payment is $127 and, now. So I based my choices on what I could immediately do in front of me, knowing, as my accountant said, you can always become more or less, but we need to get you on paper, so in case you get audited, you have a paper trail, right? The worst case scenario, you say, I'm trying, I'm going to get this figured out and I'll keep on going. So that's why I chose that to begin with. Later on, I did take insurance. I set up some contracts with insurance companies, and I later, to tell you now, I later dropped all of my insurance contracts, oh gosh, before the year 2000, so middle to late 90s, because I saw the writing on the wall. As we started moving into managed care, I had survived. I was working as an OT before managed care, and I went through quite a I went through the process at UCLA where we had to do a compilation of all our statistics, and also being involved in the state organization, and also being very involved on the physical therapy end of it. Because I couldn't get much information from OTs, there weren't a lot of OTs in private practice, I really hung out with PTs. Also because I had a lot of interest in sports medicine, so I hung out and learned what I could from other people. So anyway, I eventually dropped my insurance contracts, and now I'm a cash only for quite a while, which we call concierge care. I haven't taken insurance for quite a long time. And then, so moving on, so that was my first company. I eventually leave UCLA when I felt I had so many private practice clients that I was at that point where I couldn't get them on my schedule. So I was working part-time at UCLA, part-time on my own, still working for the home health agency here and there. And then I remember so distinctly having that fear of going, wow, what do I do? If I give up my UCLA job, I won't have insurance, I won't have benefits. So I had met with my people, right, the accountant, and now I had a financial advisor at American Express, and I just took the plunge. And within less than a month, my schedule was full, just because of word of mouth. I had good relationships with the doctors at UCLA, so a lot of them knew that I had moved into private practice, and they began sending me folks. And then I was still, still adding people to my list from the home health agencies as those contracts ran out. I would pick those people up, and eventually I stopped working for home health. So I made that transition slowly and not always easy, but I would say if you're looking at a timeline within 2 years, I mean, I remember in 87 to 89, somewhere in there, where I went into private practice. So it was after I paid off all my loans, and I went ahead and completely moved into private practice. Then I really needed to learn, because then I was negotiating contracts with larger entities, and I don't necessarily have to talk about that. That would take up a lot of time, but I began working with professional sports teams, and so I was negotiating work projects and contracts at a much different level. And again, I found lawyers, accountants, people I could ask that would help me, and I found those people by word of mouth. I'd ask the accountant, do you have a lawyer that you'd recommend for contract work? So it was sort of just building my network of people. I started my second company in a couple of different ways. When I stopped working with professional sports teams in 1996, I decided I was tired of flying all over the country, and I wanted to stay stationary. I had kept contact with, I was still seeing clients when I was in town, and kept contact with some colleagues, and I would get called into meetings where, as a consultant, people wanted to hear about my experiences, other PTs and OT clinics and colleagues as I got involved again back in OTAC. And as I shared my experiences, they would want programming and wellness. Well, we'd like a wellness program for, back pain. And those are things I was able to do based partly on some of the things I did in my master's, but also because I had worked, in this arena on my own for a while, developing lots of different types of services in my own private practice that were streamlined for my particular client. And in one of those meetings, I met my old boss at UCLA, Dave Powers, and we later talked to each other on the phone, and I said, and I think it was his idea, who said, how about putting together a consulting company called Ultimate Rehab, and I'll be the PT, you be the OT, and what we'll do is help other PTs and OTs set up their own private practice. That became an LLC, a limited liability company. The reason we chose that tax entity is because it's also easy. It also provides a firewall of protection. So if we were to get sued, they would be suing the LLC, even though there is some pass-through taxation through our personal accounts. We did have a layer of firewall in case we were ever brought to task on whatever. And then in the state of California, LLCs cannot provide clinical care. They can only provide education or consultation or anything else, just not clinical care. So it made sense that we didn't need to go as far as the corporation. It was too risky to be a sole proprietorship because there's two of us. Most often, healthcare providers don't become partners like in a partnership. That in the state of California you could, but it's not a very I don't ever see it. It's not a usual and reasonable and customary thing to do because in a partnership, if you and I were partnering on a project and you or I did something wrong, I go down with you or you go down with me. And because healthcare has so much regulations, I think that the legislative and legal process over time, almost unspoken, has decided that healthcare providers do not make for a good, partnership. And of course, that's a little bit different in the physician world. They have much more developed business laws and legislation than what we do. Now, keep in mind, I was working in private practice when we weren't even licensed. We were, an existing industry without a scope of practice. And I live through, you know, the licensure and becoming licensed. So anyway, that was my LLC, and that still exists today. We still help people set up their own private practice. We wrote books together, Dave and I. I get called in often to help people who own private practices, who want to hire and fire, you know, who need some administrative support. A lot of times it's fixing some billing problems. You know, just going through and doing a documentation compliance checklist. Do they have all the documents in place to meet Medicare and insurance contract requirements? So it's really kind of we act more as an oversight to help people meet regulations because it's so complicated. So that's my LLC, Ultimate Rehab. And then fast forward to today, last year, I formally set up my company called, actually no, this year, but I started it last year. I formally set up a corporation in the spring of this year called Go to Care, Go to Care Inc. It is a corporation. It's working in telehealth, and I do consultation, online educational courses, and also promote a type of telehealth technology. I incorporated that because there's a lot of arms to that. I felt it needed extra firewalls of protection. And based on the types of my strategic plan I have in my 3 to 5 year vision, I felt it needed to be incorporated in order to reach some of those expansion points. It also allows me a lot more firewall protection. So if I were to be sued for whatever reason, again, they're suing the company, and it's not coming in and taking up my personal account and my personal bank accounts in my life and my house and my car. So there are some, and this is just a quick version of how you would choose tax entities. Certainly in the book that I highlight here in your handout, I give you a very detailed layout of how to make those choices. So anyway, that's where I am today. So I have 3 companies. I have independent contractors that work for me and can work in all of them, but right now I'd say currently today I have 3 people working, I don't know, I have a list about 3 to 5 people working for me in my Hands for Health. And occasionally if Dave and I are consulting on a project that's outside of our expertise, we will bring in independent contractors to fulfill that contract. For an example, if we go into a practice that's working in ergonomics, we have a colleague who is very, very good in operations and administration and workers and meaning ergo, and so we may bring them in just for the project and hire them to go in and actually do an on-site visit. Or if we're doing something in a different state, we would go ahead and contract out with a colleague for them to fulfill that particular contract in that state. So that's where I got started, and that's kind of where I'm at today. Besides, as you know, I teach at SC and sit on several committees. I'm on the reimbursement and practice committee at OTAC. I'm the chair for the ad hoc committee on telehealth, and I sit on similar committees at AOTA. Okay, are there any questions in just regards to how I got started or how I made choices? Okay, so on the handout, I just gave you what I felt was, I hope, an organized way to take a concept that you may have an idea, a vision of a private practice, and move that through all the paces to full implementation. When people call me often in the beginning, they just like to talk out their idea. And I think that's always a good way to start, right? That's sort of the self-assessment. And in the handout, you'll see that I recommend that you SWOT, we call SWOT. I'm sure that Dr. Fazio had you SWOT yourself or SWOT an idea, which is SWOT, strengths, weaknesses, opportunities, and threats. That just gives you a feel for where you may have a shortcoming at your own personal and professional end and where maybe your idea needs more work. The reason I like people to do that is because there is the question of, do I go alone or do I add a partner or 2 partners or 3 partners? And I'm not talking about partners like in a partnership, but colleagues who are going to come in, put in their time and money, and we're going to split the assets. I know that when Dave and I started our company, I did not know about the administration and management in like he did. He was the boss. He ran the whole rehab department at UCLA, and I was a therapist. So he brought to the table all the administration back end. What I brought to the table was I'm a detail person. I love to write. I love program management. I'm very good with finding things and what isn't working, what does work, and I'm good at tracking trends, what I think is going to happen, what's happening in the environment. I was very involved in looking at larger global pictures of policy and administration things. So we both brought different assets to the table, and I recognized early on that I needed him and he needed me and our strengths, and that really put together a really good company. I can tell you that after we got started, I didn't know him in that capacity very well. Right? He was my boss, and that's how I knew him. What I learned through that first year of working together, was that we also had some different strengths and weaknesses that I didn't know in the beginning. So we had a sit-down meeting again at the end of the year, which I have to tell you was uncomfortable for me because I was, how you feel a little tentative about bringing up issues since the company was doing very well. But I had to say, you're really good at that and I'm not, and I would prefer that I would do this and more than you, and I'm more readily available to to do the writing and you're not. So it was really, we had to keep, and we still do, we have to, now we kind of sit down all the time, and when a project comes up, we talk about who's going to do what, when, who has the time, who has the best skills for that project. And I would encourage that you don't have to start a private practice alone, and there may be a time that you bring in other people. Either they have the finances, they have the expertise, or you have a practice that's going to have lots of different skill and lots of different services like peds and adults. And so therefore you want to be able to bring in the people that would best present your idea. The next thing I look for is, or I like to hear, is people's vision. I want you to close your eyes. I want you to see your program in action. I want to see you in the program. I want you to tell me the colors, the type of people. I want to, if it's really a physical building, what you want your waiting room to look like. A lot of times people have a very clear vision, and sometimes the vision is what they're doing inside their idea. That helps me as a consultant put your vision to words, because sometimes that's the disadvantage. I know for myself, when I went to the experts, they were putting a lot of words in my mouth because I didn't really know much. And so they would bring up things. Well, let's talk about what happens in a year. Let's talk about the 3-year plan. What are your thoughts for bringing more people into the practice? And so I like to hear the whole vision, and I like to see it written down. I like to see people spend the time, and even if you put a blueprint together, I like to see the blueprint of a room or clinic space, what equipment, because what we do is we take that and then we make it real, or we make it feasible. Right? I'm sure you learned about feasibility and did a feasibility study. And the next part of that is your mission statement. It's hard to write a mission, which is really a synopsis of your goals. And I always say pick 3 important goals to start with. They represent your vision. So your vision is, and sometimes your vision can never be achieved, but it is the sense of giving back, right? Most people want to make the world a better place by giving them a service they don't have. And so I like to see and create that mission statement. And a lot of times you'll use parts of that mission statement on your marketing website or materials, or maybe even your business card. So I try to take your vision, help you, and put together that mission statement, which you probably did on your work in your class. And I always say try to choose something that is 25 words or less. And when I teach the business plan class, I would sit there and we'd go through and break down into parts. Who are you? What are you going to do? How are you going to do it? And what's the goal you're trying to reach? I want those things to be answered in the mission statement. Who you are, what you're going to do, who's going to receive the care, and maybe how. maybe something unique about your service. A lot of people will use very common words that are common to our industry, like, oh, okay, well, occupational therapy services. Well, if someone walking out on the street reads occupational therapy services, they're not going to know what that means. And so often I'll say to people, you need to take out the jargon. It's our jargon. You need to put in things that look like a menu when you go to a restaurant, right? When you look at a menu to order something, not only do you see a name, but that name probably represents pretty closely the ingredients that's going to show up on your plate. So same thing. That mission statement is about putting together those ingredients so when people get done reading it, they go, okay, yeah, that applies to me. I want that service. A lot of times I'll see mission statements that they're too global and at times, and they don't direct you and they don't direct the consumer to make a choice in your way. Step number 4 is defining your business concept. And this is what you do through your feasibility study, or what I call market research, where you're going to go out and look to find, to write in and fill in the blanks of a feasibility study. You know, your population, what age, what's their income, do you need insurance, what's maybe the best tax setup for you, tax entity, is it an LLC or a corporation? Are you going to get a physical building? Is that building, you know, ADA compliant? Do you understand how to document? Do you plan on charging insurance? And so it's answering those specific questions to help take your now vision and mission statement and move it into, okay, that's real. Yes, I have a building, or yes, I have an idea. I have an audience. There is a need. I'm going to fulfill that need with these services. Yes, I will charge insurance. And work through some of those details up front. That helps you fill in the blanks for a business plan in actuality. And that's why that beginning research is so important. So I'm not sure what your class presented, but when I was teaching it, we have a market research, and we take those answers and plug them into the business plan, and then we can fill in the rest. Step number
Jamie,
5.
Can I interject?
Yeah.
Can I interject?
Yes.
What do you recommend for us as students right now in developing our business concept? And it looks like it's going to develop in stages where maybe the first stage it's more of a consultative service in nature, and it maybe develops into a clinically based practice. Do you recommend having the same legal structure from the beginning, or have you seen businesses change where in the first part maybe they're in other people's homes and they are a consultative business and they're an LLC, but then they want to get a building down the road for their vision and they need to be a corporation? Would you recommend starting from the beginning as what you envision yourself at the end, or just kind of being more present in what you are?
That's a really good question, and it was a question that I had early on. And I'm going to give you my opinion. I'm going to give you my opinion because I think that it works the easiest. It would be to start where you presently are. You can always move from an LLC to a corporation. You can always become more. It's harder to become less, right? Once you are incorporated, you know, and you go ahead and you get all the fancy bank account, all that stuff, to completely change all that it's just time consuming and it's difficult. The only time I suggest that you not listen to my advice I just gave you is if you're taking insurance companies, payers may have very clear limitations or restrictions to your tax entity. Some payers may require that you're incorporated from the very beginning if you're going to charge insurance. So again, you have to kind of go, you know, that's why the business concept and the business plan is so great. When you get to the paying part, who's paying you, and do they have any limitations? So let's start from the beginning. So I have these 4 legal structures. Today, the easiest thing to do is to become a consultative service and be an LLC. Can I do that in my scope? My first question is, can I do that in my scope of practice? Well, I read my scope of practice at the Board of OT at California, and I can. Number 2, do I need to register with the Secretary of State in California? As an LLC, yes, I do, and I need to register in the county of which I live. Can I do that all online? Absolutely. So I'm going to go ahead and take care of the small business stuff. That's easy enough. Should I open up a bank account? I recommend it. because if you're getting audited, even if you move to something else, it's good to be able to separate your personal and your professional business. So go ahead and start that bank account that has an LLC name on it, if that's what you're going to do as consultative services. If you get further down the line, and then let's look at who's going to pay you. So that's sort of the beginning. Now, who's going to pay me? Well, the client's kids. So we kind of have two big fields. I always say, here's insurance programs, and then here's cash or check or someone. And so draw the line down the middle. If it's people, not insurance companies, then sure. Then you don't have any limitations or regulations. You're ready to go, right? You may want to be able to have the ability to take a credit card. Maybe that's something else you need to do. If I'm going to take third-party payers, insurance companies, and if I were satisfying a grant, some grant, in fact, most grants often you have to be incorporated. So I would need to know that, for my payment structure. So my payment says, those oversight committees say I have to be incorporated, I won't have a choice. I'll have to get incorporated if that's the only way I can get paid. So it sounded like in your class a lot of you were moving into grant programs or granting. And keep in mind that different grantors have different requirements on how you're set up as a company. They may request you're a 501c, or they may request you're a corporation. So it's sort of a long answer, but the easiest is to step the way you are and get to it and get the experience, and you can always become something else, either because you have to or you want the protection that you get being incorporated. Did that help?
Yes, thank you.
Step 6, choose your organizational structure. Really, this is my way of helping the person decide if you're going to be an assisted living center, if you're going to set up a halfway house for adolescents to come to for mental health services. Anytime you're going to have a certain look, and you're going to become a certain entity like an assisted living center or a halfway house or something else rather than just a private practice clinic in the community where you're renting out a space in a building, those structures, like I just said, in a nonprofit, have their rules, and so you need to know those. So we look at your idea, I look at your business plan, and then I say, are you going to be in a building where you're renting? Is that building allow health care? Is it permitted for health care services? Or are you going to be a nonprofit? Have you met the nonprofit requirements as a business? So that's your organizational structure, level. Number 7 is then registering in your business names, and I just I briefly talked about that. So once you move into naming your company, you do need to register it and fulfill those small business requirements in the state of California, and every state's different. So if you plan to work elsewhere, you'd want to, again, go straight to the Secretary of State department in that state to meet those requirements. Every state now has an online presence, and so when I set up my corporation, I made one phone call to my accountant to get his feedback, and then I fulfilled everything online. So I didn't have to drive and do what I used to do when it changed. Everything is a web portal. Step number 8 is write that business plan. So you have a template to a business plan, fill that in. And part of that business plan is the marketing plan and also is the financial piece. I want to make sure that people have really looked at their financial piece and that it makes sense. People often ask me the question, well, how much money do I need to have up front before I start? And because if I take insurance companies and I'm going to have a contract with them, a fee schedule contract, it takes somewhere between 3 to 6 months to get that set up, and that's if I do it right the first time. So knowing that, you need to have enough cash to live on for 3 to 6 months. And if you're negotiating a lease for a clinic space, I always recommend that when you're meeting with the landlord that you'd like to suggest or negotiate out, can I have a month free? Can I have 3 months free? I need some build out money. I need some build out time. And so you try to negotiate your renting, your lease agreement to sort of match when you know that money's going to come in, because basically you're working for free for a while until you get those fee contracts if you're taking insurance money. So that financial piece is very important because you need to get paid. And I like to make sure that's really worked out and planned out, and that you've begun to make those contracts with the insurance companies before you open up your door. Step number 9 is preparing a marketing plan. You know, that makes sense, you know, and people ask me, well, how much money should I spend in marketing? Well, in our industry, the benchmark is 1% of gross income is spent on marketing, which that's hard to know, right? How do you know what you're going to gross the first year? So that completely doesn't make sense when you're starting. So I always like to see the marketing plan. You know, the best marketing is free, and word of mouth is the best marketing. So a lot of people will come to me, and I'll look at their business plan, and they have it all set out. I'll even look at the marketing plan, and then I'll say, well, how many customers do you have? Well, you know, I was working with these 3 families, and they told me that they will go ahead and pay cash if I continue to see their children in their home environment, in their natural environment. And I will say, well, that's only 3. And what happens if one of the parents lose a job and they no longer are going to pay you cash? So I find that people come to me very excited because they have some guaranteed customers up front, but then they haven't thought out, well, what happens when those customers leave me? And that was my biggest fear, and probably is always an underlying fear you have when you own your own private practice. Right, and let's step back. So some of the advantages of private practice is I have flexible hours, I pick and choose my days, which also means I pick and choose my money. So, for instance, I was gone last weekend to go visit some family members. I didn't make any money. These particular patients or clients of mine, I could not send someone in to cover for me because it was not in their specialty. It was my own specialty. And so I not only did I pay for a trip, I lost money. So when you work in private practice, you determine your financial gain. You also determine your financial loss. I have to pay for my own health insurance, right? I have business taxes like everybody else, et cetera, et cetera. The exchange for that is I have a lot of flexibility. I have a 7-year-old daughter, so I work 3 nights a week and 6 days a week, which seems like a lot, but the truth of it is I have afternoons off here and there, so I can go volunteer at the school, so I can go get my own things done, so I can go to the gym and work out, right? But I spend at least 60 hours a week working, driving, you know, doing the paperwork, all of that. So it's a commitment. The flexibility is nice, but keep in mind if you want a secure income, and security is one of your weaknesses, you know, private practice should be something that you work towards, because you never know, right? And if you're counting on insurance payments, keep in mind that the insurance environment in California is what we like to call hostile. It is constantly changing. We've just gone through a series of flat rates, so Anthem Blue Cross only pays $75 per therapeutic session. United Healthcare or Optum only pays $65. On an average, HMOs will pay $42 to $45 in a session. And Medicare is under a potential cut starting January 1st. So nowadays, you know, since we know the numbers, we can look at how much net you can make. When I started the practice, you could make net. You could walk away with 15 to 20% net. Nowadays, I would say net is closer to 3 to 5% of what you're going to put in your pocket. And there are ways to cut overhead, you know, by cross-training employees. I mean, there's a lot of tips and tools that I advice I would give as a consultant. But keep in mind, it's not the plush business that it used to be, and it's because we're in the state of California and the payment market is so restrictive. That's why I sit on these committees, so I can hopefully find opportunities for us to make, like telehealth, using technology and other ways to make money. So number 9 was preparing that marketing plan. Number 10 is obtaining advice and experts. Yeah.
Excuse me. So would then it benefit you to accept payment by cash, non-insurance, from the families who had more money? and weren't dependent on being in a disability category?
You know, my answer to that is, let's think of reimbursement as a pie. And in that pie, I'm going to cut different slices of it. And so I think in the beginning, you may want to do all of the above, right? You may want to go ahead and begin the insurance, because a lot of people, especially in tough times, we're in tough economical times, so people are going to want to use their insurance, number one. Number two, by the year 2014, every person has to have an insurance policy. My gut feeling is that people who don't have insurance policies but then are going to spend their hard-earned money meeting the requirement are going to demand to use their insurance. So I think it would be beneficial for you to go ahead and pick and choose the insurance companies you want to have a relationship with, but also offer cash services. You can always take cash. You don't have to charge the insurance companies unless it's Medicare. Medicare you have to charge first, and then if you discharge that person from occupational therapy services but move them into, let's say, a wellness program or some other service that you would have that was supportive of the therapeutic home management program, then you could go ahead and take cash. Does that make sense? So in my practice, when I was taking insurance, I would go ahead and charge the insurance companies, and then they would get discharged from therapy. At that point, I had another arm of Hands for Health, which was wellness. And if they wanted to come and use the wellness services, which may or may not be me as the instructor, I have a couple personal trainers that work with me, then they could come back and continue their therapeutic exercise, but maybe with a trainer, and they would be paying cash. So you have different ways to satisfy the financial need, and I would say, talking to you today in the year 2012 and that the year 2013 will be very, very telling, but looking ahead to the Obamacare initiatives, that you would probably want to take insurance and also set up cash services. Does that answer your question?
Yeah, thank you. That's
okay.
A great answer. I love your wellness center.
Yeah, wellness. Wellness services can look multiple ways. And I think that's where we're going. I mean, the thing about wellness is we've been talking about it for a long time. There's not a lot of good of what I call good ROI, return on investment models, because in our practice we still struggle within the legal aspects of when is it OT and when is it wellness? When do I have to charge insurance and when I don't? And it's gray. And I'm only giving you advice from me. I'm not speaking on behalf of OTAC and AOTA. I'm talking to you from Tammy, the OT consultant. So wellness can look a lot of different ways, and Obamacare is very supportive of wellness, right? We're at this place in healthcare reform because it's so costly for people to go in through the ER. And so we want people to stay at home and stay healthy. I think that OTs are just in the right place at the right time to do that. More than other professionals. That's what we learn to do, right? We learn to be with people in their natural environment and to be well in that environment. So if my job was to set up services so they don't have to go see the ER or see their doc and go to the ER, but they have, 5 of those really huge cost drivers in chronic disease management, COPD, CHF, diabetes, obesity, heart disease. What kind of services would I want to set up for them at home? It probably looks like exercise. It probably looks like nutrition guidelines. It probably looks like home modifications. And so just think big and know that you can do it. And that part doesn't have to be run through insurance. When you're doing therapeutic and skilled therapeutic intervention, that you have short-term goals and they require that kind of skill, then they need to be therapeutically done, and they can be run through insurance. But we know insurances are always short-lived, right? You get 10, 12, 8 visits, whatever that is. So again, number 10 over here on the 15 steps overview is obtain advice and experts. So like you're coming to me, I'm giving you advice. I always say talk it up. talk it up for a while. Talk to your friends, talk to your parents, talk to your colleagues, talk to people. You know, all the associations, OTAC and AOTA, has people like myself who volunteer to talk for free, to give you advice. Go on to the online forums, OT Connection, AOTA. You can go into blogs, ask the questions, give them some scenarios, and get people's feedback. I always think that helps get over the fear of some of the aspects that you're looking at, and also gives you some support. And the one thing I realized this far out at my mature, hopefully, state of mind is that, and one thing actually I did well, I always ask questions, but now the benefit of having the network of people, the benefit of being involved in OTAC and AOTA, where I can ask the questions at conferences to people through these online forums, is so beneficial. So definitely take advantage of all that. I'd also recommend the very beginning to get some of your research done through our industry journals. You know, there's Advanced for OTs, there's Advanced for Rehab Managers, there's the OT Practice, any of those where people like myself and my colleagues write articles. A lot of professors have to write articles for their tenure. So you see, you know, some really great information going through the journals and these other online presence portals. And so soak that up and keep looking. I belong to every email list. Every day I'm combing through tons of information so I can keep my finger on the pulse of what's happening kind of locally and around the country. Step number 11 is complete those startup tasks. So again, once you've made that decision, you're feeling pretty good about it, you know, back to I think Sean's question is, you take the leap and start off simple. I've seen business plans where they're going to spend $250,000 on equipment, and I say, why? Because if you sink, what are you going to do with that? I mean, even if you do a fire sale, you're going to get, you know, $1 per $100 of what you spent. So don't start off expensive. You can buy, you know, turned-in leased equipment, you know, refurbished equipment with a warranty. You can purchase, you know, things that are less than top-notch, and then when you get, you know, up the success ladder, go back and upgrade, and then write it off as a tax, you know, as an expense. So sometimes people, you know, because I encourage the big vision, I also encourage practicality. So let's just get you off the ground with what you have, with the skills you have, with the opportunity in front of you, and then we can build up, right? And sometimes that means instead of opening up your own clinic, you know, I mean, there's so many of my colleagues who I think are renting out space. Just walk into an existing PT, OT, chiropractic, acupuncture, even physician clinic and say, are you renting out a room? Start there. That's really minimal. Right? And then you're in an environment of which supports you, right? And you've got colleagues around, and they usually have front office people that can take care of some of your administration needs. So be very creative in the startup task. And then you have all those small business things that I spoke about, you know, get registered, start the bank account, you know, get your business card, some of the basics. In the book, that is Business Fundamentals, I have a startup list. I have a startup operations cost sheet. I have several templates of fill in the blanks, which I won't have time to go through today. But I recommend that if you get an opportunity, it may be worth just getting those startup lists so you can, you know, fill in the blanks. How much would it really cost me to start up my company? And to do a cost, you know, a break-even analysis, which I have a template for that in the back of the book. And then step number 12 is hiring your staff if you need it. In the beginning, I did everything by myself. I still do all my own reconciling, all my own accounting. I bought matching software to my accountant. So he uses QuickBooks, I use QuickBooks. I use QuickBooks because we have to share numbers. I have a financial investor who helps me with my strategic plan. So whatever they recommended, I use. I'm very much a control freak, so I control all the data, and I stay in contact with my network of people often, so I know exactly where I'm at. And in the beginning, you just don't know, you know how much money is coming in and what's going out, so you're kind of flying by the seat of your pants. But that's just the way it is. You know, you can't predict it. Hang in there, because after that first 9 to 12 months, it all begins to make sense. Also in the book, I have a management checklist, and so what that management checklist does say, every week you should do this, every 2 weeks you should do this administration, every month you should do this, every biannually you should do this, every year you should do this. So it's a quick check-off list just to help keep you on the path of fulfilling all the new things you need to do, because it's a lot. I mean, it's a lot for me. So if you need staff, you may want to think about, you know, just hiring independent contractors instead of taking on an employee, where then you need workers' comp and you need insurances. So also be creative, or you could share a staff person. If you're working inside an office, you know, maybe and you're renting a room, maybe you can, you know, maybe you can borrow the therapy aide. The therapy aide can work both for the PT and you, or the chiropractor and you. So be really creative with your folks if you need additional help. If you're bringing in a partner, that's a different conversation, and then we look at who's going to do what, you know, clinically versus administratively. Step number 13 is implement and manage your business operations. I think I just, you know, already gave away the answers. So those are all those daily checklists I was just talking about. On a weekly basis, you reconcile your account. You know, you pay your folks every 2 weeks. You make sure the super bills are into the insurance company. So there's just all of that business stuff. And instead of me going over all of that, you know, again, not to promote my own stuff, but there is a checkoff list in the book. And then step 14 is financial management. And this is the part where people start off really good and then they get really bad because no one likes to talk money and no one manages it well, and at times I don't either. I have certain areas in my life where I blindly pay for anything associated with my daughter, right? So, okay, you want this class? Okay, I think that looks like a good class. But what I find is when I get called in to consult, it's always about the finances, and I'm sitting there and I'm looking at the costs, and I'm adding up the numbers because no one else has, and I'm going back. The most common area of overexpense is staples, is office supplies. You know, typically we get carried away. I do too. I go into Staples, and instead of just going for one package of paper, I come out with 10, 12 items. It's like going to Target. So people start ordering pens and paper, and the front office person gets excited, and they start off, you know, ordering more. And so it's always the paper products. Or when they need therapeutic putty or hand splints, they'll buy 20 of them. And number one, you don't have the space probably. Number two, why buy something that far in advance when most companies will run a sale, can ship to you in a day, can have free shipping, and you have just spent money that you really presently need. So don't spend money that you can spend later unless you need the write-off. So I usually look at where all the costs are. Most commonly, they're in that paper product, you know, office supplies. The next common financial mistake people make is letting too much money walk out the door. So if you're going to take insurance companies, most of them have a co-payment, and it says co-pay on their card. You and Medicare are required to collect that copay. Do not let that copay walk out the door. I can tell you that that happens all the time because people will start a business and they're so eager to keep the consumer. The consumer will come in and you'll say, listen, you have a copay of $40 or $20, and they'll say, well, I forgot my checkbook. And you're going to say, wow, well, you know, I'm sorry, but we really have to have the copay in order to get the treatment started. That's a hard conversation to have. So what I recommend is that you have a sign in one of those plastic, you know, paper holders that you can get from Staples up front at the office or on your website that says, make sure that if you have a copay that you will be expected to pay at the first day of service. Because what happens is that if you give them a freebie, they'll go out and then you'll have to bill them later, or they will maybe keep forgetting, or when they come back, you're going to say, well, you've forgotten 3 times, so now it's $60. They're going to be like, what? $60? Well, that's a lot of money. And so pretty soon you find yourself negotiating with something that is really non-negotiable. So again, my point is look at your overhead. People get excited about equipment and paper supplies. Number 2 common error is people let the pays go out the door. And then number 3 is that they were so eager to get a person to work for them, a staff, that they've overpaid the staff, or they promised the staff too many weeks off. And all of a sudden, when you really need them, that person's off on vacation. And so what happens then is that you promise someone full-time, but you're not as busy now near the holidays, and how do you move them to part-time? So you need to be very careful about hiring people in at what level you hire them in, because it's hard to go backwards. Just financial management. And step 15, before we all have to go, is filing those compliance reports. And again, all of those are found on a your accountant would be helpful. He helps me anyway, and on that checkoff list for your business operations. So those are the 15 steps in the handout. I'm hoping that that would help sort of move you to taking something from a concept into implementation. Does anyone have some questions for me? I may have lost everybody.
I just have a more general question.
Okay.
Why do you think that more occupational therapists aren't getting into this area and starting their own private practices?
I think a couple things. Number one, it's hard to know where to go for information. They don't know where to look, and sometimes the first step is they go to OTAC, and if they don't get immediate answers or don't get the answers that meet their specific questions, which can happen, then it's just discouraging. Secondly, I think that people it's the feeling of insecurity. If you're in a secure place and you move into private practice, which is insecure and flexible, it's scary, and it's not for everyone's personality. So I think that most of the time students will say, well, I'm going to go out and work for 5 years because I need to pay off student loans. Get that, understand. But on the side, you can begin to do these things. And I think starting slowly is the way to go. So my third answer to you is people think it's all or nothing. It doesn't have to be an all or nothing answer. It doesn't have to be that you're full-time in the beginning. You just start off unless you want to, unless you have that personality and the resources to get started. I always say to people if you feel better, go find a job and begin working on the side with those few families or towards your, setting up your own thing, because it takes a few months. It does. I mean, even for me, and I'm seasoned, just to set up my corporation took 5 months. I really spent the time filling out the paperwork, getting it in, waiting to come back, advertising in the newspaper to make sure no one else had the name, all the requirements. Time goes by. Setting up the bank account, setting up a business a bank account, so it takes time. So I would say, I think people shy away because of the administration end of it, and it seems too much, too scary. And I always say, go slow, spread it out. Any other questions for me, maybe particular to your project before I have to go?
I have a question about what class you teach at USC. I admit I don't recall that you...
Oh, that's okay.
I did not hear that about you. That you
I'm teaching. I think I'm teaching in January. It's always dependent on how many students sign up. The last 2 years, I've taught a course on telehealth using technology to provide occupational therapy services, and that's what is projected for me to teach in the spring. However, I did just email them to say I'm really open to teaching the community-based business plan again, which was another class I taught, which was just writing the business plan. So at the end of it, you have a full business plan, a full marketing plan. We have gone through all the financials, and really you could step away and implement it.
Great.
So I'm an adjunct professor, and normally I teach in the spring. So that's the kind of the heads up I can give you.
Okay, and this is for the OTD program or the master's?
Both.
For master's.
Okay. Oh.
And then I'm moving several classes. I'm moving everyone else. I'm moving to online courses. So all the telehealth courses. So if you missed my telehealth course I'm teaching at SC, I have just put together 3 on-demand courses with me not speaking, and then 3 webcasts. They match each other, same information, just where one's live and I'm talking and when I'm not. So there's 6 of those, and those are done. They're in their editing, and they will be up on my website, gotocare.com. And then when I get done with those, my thought was to go back. I do have some coursework on setting up a private practice, which I probably should put into an online course because that would make sense. That way you don't have to track me down or anyone else down. There'd be something out there. So, you know, maybe look towards online courses. And again, my website, gotocare.com, would be the place hosting most of those. It's set up to do that.
Great.
Any other questions for me?
Hundreds of questions, but not for today, maybe.
Okay, listen, I really appreciated being asked by students to have today's podcast. And if there are more questions that come up, and there is even just 2 or 3 of you, this is a really easy format for me. I'm going to stop the recording right now and just talk to you informally, so hang on.